Hey there, so this presentation is about acid reflux. It's something that's pretty common. It affects a lot of different people, and conventional medicine doesn't do a really good job of helping us out with it in a way that doesn't further harm us. So let's take a look and dive in here. Acid reflux occurs when the stomach acid flows from the stomach back up into the esophagus. And if you have chronic or repeated occurrences of acid reflux, it's called gastroesophageal reflux disease, or GERD. The most common symptoms include a burning sensation in the chest, called heartburn, backwash of food or sour liquid into the throat, pain in the upper belly or chest, trouble swallowing, or a sensation of a lump in the throat. Acid reflux may also cause an ongoing cough, inflammation of the vocal cords, or new or worsening asthma. And this occurs when the lower esophageal sphincter does not close correctly or in a timely manner after food is pushed from the esophagus into the stomach. So basically, a malfunctioning LES is the reason acid reflux occurs. Just to give you a little background of anatomy here, reminders, the esophagus is the tube in the gastrointestinal tract that connects the mouth to the stomach. And as food is pushed from the esophagus into the stomach, the cells in the stomach lining secrete digestive fluids, including gastric acid. The stomach lining is protected against that gastric acid, but the esophagus is not. So the LES needs to close to protect the esophagus from any of that gastric acid. And the LES is a bundle of involuntary muscles that act as a valve. It's located just above the diaphragm, which is the wall, the muscle wall between the chest and the abdomen. And it acts as a valve based on autonomic nervous system signals. Some reasons that the LES sphincter might not close correctly include if we have any issues clearing food out of our esophagus, like we have a constriction or inflammation, or we have diminished salivation. Delayed gastric emptying can also cause the LES not to close correctly, or gastric distension if we're overeating and our stomach is extended, or even we have bloating. It can put pressure on the upper stomach, and that will in turn pressure the LES. We could have just a lack of muscle tone in the LES tissues, or we could have faulty neuron signaling, so those nerves might not be firing right. And then another thing would be a hiatal hernia, which is a condition where there's an opening in the diaphragm and it allows the upper part of the stomach to move up into the chest, and that moves up into the LES as well. There are certain factors that can exacerbate the symptoms of acid reflux. Important to note, these things don't cause acid reflux, but they can make the symptoms worse, and they will vary considerably from person to person. Now, sometimes they are touted as the cause of acid reflux, and they're not the cause. Smoking is definitely the first one, or even inhaling secondhand smoke. Caffeine, and that includes caffeinated beverages and even foods like chocolate. Sometimes fatty foods. Excess weight or obesity definitely puts pressure on that stomach and will definitely put pressure upwards into the esophagus and the LES. Overeating can again distend that stomach. Tight clothing. Certain medications. So let's go through these. Benzodiazepines are sedatives. They're used when people have anxiety or need calming or sleep. Calcium channel blockers and beta blockers are used to treat high blood pressure, so they're very commonly prescribed medications. Bronchodilators, and then theophylline for asthma meds. They help relax bronchial passages. In doing so, they also relax the esophagus. NSAIDs are anti-inflammatories. Tricyclic antidepressants are used for like major depressive orders, clinical depression. Anticholinergics block acetylcholine, which is the main substance used for neurotransmitters. So that can definitely affect that nerve function. They are used to treat motion sickness and a few other things. And then progestin, which is a synthetic progesterone used in birth control. So any of these medications can cause things to happen that will make that acid reflux worse. And then pregnancy can obviously push on that tummy and push those organs into places they're not supposed to be. What about high stomach acid? Because this is on the conventional side where doctors tend to go, well, you have too much stomach acid. High stomach acid is not a cause or a contributing factor for acid reflux. There is no scientific evidence, no clinical studies to support this. Excess stomach acid secretion is actually pretty rare. There's a genetic syndrome, Zollinger-Ellison, and then if someone has hypercalcemia, they might have excess stomach acid. But the most common symptom, if you have elevated stomach acid, is going to be a gastric ulcer. It's going to wear away and damage the gastrointestinal lining. It's not going to cause your LES not to close. And adequate levels of stomach acid are really, really important. We want to have enough stomach acid. It kills bacteria that may be present in our foods or drinks. It activates digestive enzymes that help us properly digest proteins, and it helps the body absorb minerals like magnesium, calcium, and iron, and other nutrients like B12. So the right amount of stomach acid is extremely, extremely important. And your body, especially your stomach, needs a finely tuned pH balance. So your body controls that stomach acid balance and doesn't let that stomach acid get too high. It's really good about that. So most people will definitely experience acute episodes of acid reflux at some point, like, once in a blue moon or something. It might trigger something, but chronic acid reflux or GERD is serious. It can have serious health issues long-term, including erosion of the lining of the esophagus that can result in bleeding and ulcers in your throat, inflammation or stricture of the esophagus, even pulmonary restriction, and Barrett's esophagus. Barrett's esophagus is a condition in which the tissue that's similar to the lining of the intestine actually replaces the tissue that's lining the esophagus. And this is a very, very strong risk factor for esophageal cancer. There are two classes of pharmaceutical medications that are typically prescribed by conventional medical practitioners to treat GERD or acid reflux. And they work by reducing the amount of stomach acid secreted, which we just said isn't the root cause. So the biggest class is proton pump inhibitors, and there's some examples like Prilosec, Nexium, Prevacid, Protonix. Most of these are prescription medications, and some of them are available over the counter in lower doses than the dose that you can get through a prescription. There's also what we call H2 blockers, and examples of those are Pepcid and Zantac and Tagamet. Most of those are available actually over the counter. In addition to reducing the secretion of stomach acid, they may also inhibit production of pepsin, which is an enzyme that's critical for digesting our proteins. And if you need a reminder of how important proteins are, then you can check out the protein presentation. Common side effects of these meds often include headaches, diarrhea, or constipation. They do create some digestive issues, dizziness, nausea, itching, and then they definitely have long-term health risks. You can get infections because of suppressed immune function. You can develop kidney disease or dementia because they do affect the central nervous system. You can get bone fractures and then nutrient deficiencies. If we're not able to digest our food correctly, then we're going to be deficient in nutrients, particularly those amino acids and B12. These medications can also interact with other medications like seizure meds and blood thinners. And again, they're not treating the underlying cause, and they're very possibly making the condition worse. How could they make it worse, do you say? Well, let's talk about low stomach acid, because that's what they're doing, is they're lowering stomach acid. The way that low stomach acid levels contribute to acid reflux is a couple of different ways. So if we don't have enough bacteria, or we don't have enough stomach acid to kill bacteria, then we get bacterial overgrowth. And some of the symptoms of that include bloating and gas, which place pressure on the stomach and the LES. We also have reduced digestive function. So that means that we could have undigested food get into our system. That leads to inflammation. That compromises GI function and integrity. And then we have that malnutrition. So we have nutrient deficiencies. And if we don't have the nutrients we need, then our cells, our tissues, our organs can't perform as they should, including that LES. So low stomach acid may actually be more directly a root cause for acid reflux, in addition to these issues that we just talked about. If you remember, we talked about the LES as a group of muscles, and it is controlled by signals from the central nervous system. And it gets its signals from special types of neurons, enteric nerves in the gastrointestinal system. So the absence of adequate levels of stomach acid may actually prevent those nerves from communicating with the muscles of the LES to tell it that it needs to close. Because remember, the nerves and neurotransmitters react through feedback mechanisms. So they look for the presence or absence of something to do something else. So how can we, if we don't want to take these meds, address our acid reflux? And if we're looking at just the symptoms, then we've got different things we can do within lifestyle practices or foods or herbs. So within lifestyle, if we're overweight, then we can try to lose weight. That will help. Definitely quit smoking. That's a big one. Avoid tight clothing or belts. We might also try elevating our head when we're sleeping. Reducing stress is a really big one because there's a huge connection between your gut and your brain. So if you're stressed, your gut's not going to work right in a lot of ways. And then we also can avoid eating within 4 hours of bedtime. So within foods, we can avoid trigger foods, fatty foods, spicy foods, foods that we have sensitivity to or intolerance to are going to create those digestive issues like bloating and gas and make that acid reflux a little worse. So we can try to avoid those. We can reduce our consumption of caffeinated beverages and carbonated beverages. We can consume smaller meals. Avoid bending over or exercising right after we eat. And then a lot of studies have found that consuming carrot juice or cabbage juice is very helpful in alleviating some of those acid reflux symptoms. And from an herbal perspective, what we're looking at here is demulcent herbs, and what they do is form a protective coating over those inflamed or irritated tissues, and they help soothe and heal those mucous membranes. So some of the things that you might look at are drinking aloe vera juice, and you want to make sure that you're looking at the inner gel only for that juice. You might be able to use DGL tablets or deglycerinized licorice syrup. I never get that right. You can also use marshmallow root. It's really good as a cold infusion, or you can drink slippery elm tea. Now, I do recommend anytime you're looking at herbal remedies, that you work with a clinical herbalist so that you can make sure that you're matching up the right herbs with your own symptoms and root causes and constitution. But we also want to address the chronic issue. We want to look at the root cause. We have to understand what that root cause is, and then we want to alleviate it so that we don't have those long-term risks. So one of the things that we said that could be a root cause was a hiatal hernia. And that's that condition where there's a hole in the diaphragm, that wall between the stomach and the chest, and it pushes up through the diaphragm and into the LES. So that's definitely a physical issue. Your doctors can detect a hiatal hernia by doing either an x-ray or an endoscopy. Typically, they're going to ask you to use the meds, but they can repair it using surgery. If you don't want to do surgery, then there's a couple of other methods you could look at that might be ways to resolve a hiatal hernia. So certain types of massage are going to help. Hanging upside down, like from monkey bars or maybe even an inversion table, can help. And then drinking a large amount of liquid and jumping up and down can sometimes help. Good to know if you want to avoid surgery. Then another big root cause was gastric distension. Remember, caused by either overeating, which we can avoid, or foods or things that trigger bloating and gas. So we can, again, remove those foods from our diet and try and minimize that. On the herbal side, there's also carminative herbs that can help reduce gas and bloating. Some of those would be chamomile tea, fennel seed, ginger root, and peppermint. If you have a physical obstruction or a stricture of the esophagus, then taking smaller bites, chewing food thoroughly is kind of your options there. If we have an actual lack of tone or function in the esophagus or the LES, there's a test called esophageal manometry, and it measures those muscle contractions in the esophagus that are pushing the food down, so it can tell how strong they are and what speed they are, etc., to see how that's functioning. And one of the things we could do in this area for an actual lack of tone, herbs with an astringent property and a vulnerary action can help to actually tighten up or tone up those tissues. So you could try using some of those. Calendula, plantain, or golden seal are good options there. We can also make sure that we're getting the right nutrients to support our nervous system, because remember that the function of that LES is getting signals from the nervous system telling it when and what to do. So we want to make sure that we're supporting our nervous system. We can specifically do exercises to strengthen and support the vagus nerve, which is a nerve that runs down the spine that connects your brain to your gut. And some of the things you can do to strengthen the vagus nerve, anything making sounds of vibration, so humming, singing, or gargling are all going to activate that vagus nerve. And then the other thing we talked about was how low stomach acid might actually be a root cause itself. So in order to increase, we can do a test. That your doctor can do one, but you can do a simple at-home test too to figure out if you've got low stomach acid. And if you need a supplement, you can use betaine HCl supplements. Recommend 200 to 600 milligrams before meals. Or you can include more foods that have HCl, like quinoa, spinach, and beets. You can also use herbal bitters and blends of herbs that have the bitters action to stimulate production of digestive fluids. And some good ones here are dandelion leaf, gentian root, artichoke leaf, or Oregon grape root. So to recap, acid reflux is when stomach acid flows up into the esophagus. It's caused by a malfunction of the lower esophageal sphincter. There are dietary and lifestyle practices that may contribute to those symptoms, making them worse. And there are also several classes of medications that contribute to those symptoms and make them worse. It is not caused by high stomach acid. Chronic acid reflux has serious long-term health issues, so we don't want to take that lightly. But the conventional medicines do not address the root cause. They may even make it worse. Low stomach acid likely contributes or causes the condition. But fortunately, there are various lifestyle practices, nutrition habits, herbs, and supplements that we can look at to address both the acute symptoms as well as resolving the root cause for that chronic acid reflux. So hopefully this has been some good information. It'll help you guys maintain your own health, talk to your doctors, and thank you for watching.